Hello students. Okay, today we will see something regarding pathological calcification. So before getting into the pathological calcification, first we will summarize, in the sense we will brief out what is regarding calcium. So as you all aware, calcium is one of the mineral which is required for the bone functioning as well as where it is stored in our teeth. It is also required for the proper functioning or to maintain the normal physiological functioning of nerves, heart as well as the muscles. So mainly the important functioning of calcium is it is stored in our bones as well as in the teeth. Excluding bone and teeth, and if it is stored away from that is in the extracellular spaces, that will consider it as pathological calcification. So mainly the normal calcium will be of 8.5 to 10.7 milligrams per deciliter, and second thing is mainly this calcification will be diagnosed by doing the test which is called as ionized calcium blood test. Okay, through this investigation we will come to know the normal value, in the sense level of the calcium which is present in the body. Okay, once we will get into the pathological calcification. So the definition of pathological calcification is, as I said before, abnormal deposition of calcium salts which is occurs rather than the bone and teeth. So this we will be considering as pathological calcification. Once again, it is divided into two types, that is dystrophic calcification and metastatic calcification. So dystrophic calcification is nothing but where it is stored in the dead and degenerated tissues, and metastatic calcification is where there will be impairment in the metabolic activities which leads to the impairment in the calcium levels in the body. So as you all aware, there are two types, that is hypercalcemia and hypocalcemia. So hypercalcemia is increased in the level of calcium level in the body, that is more than 10.7 milligrams per deciliter, where the patient will be having the symptoms of fatigueness, tiredness and so on. Hypocalcemia is less than reduced in the calcium level in the body, that is less than 8.7 milligrams per deciliter. So once again, including in these conditions, patients will be so weak, their bone mass will be very lean, and the bone weight will be very less, and that leads to the tiredness, fatigueness and so on. So first we will see into the dystrophic and metastatic calcification. Dystrophic calcification is, as I said before, it is characterized by where the calcium is deposited in the calcium salts or deposited in the dead and degenerated tissues with normal calcium metabolism and normal serum calcium levels. So this part we have to observe, because in dystrophic calcification the calcium metabolism will be normal as well as the serum calcium level will be normal, but there will be extracellular deposition of calcium salts in the dead and degenerated tissues. This is nothing but dystrophic calcification. Whereas in metastatic calcification, where there will be a dearrangement in the calcium metabolism which leads to the hypercalcemia. Okay. So there won't be proper storage of calcium, which but it has the dearrangements of metabolism, especially calcium metabolism, which leads to the hypercalcemia. So if you want to see in detail regarding the dystrophic calcification, so mainly calcium salts are present over the dead and degenerated tissues, that is the necrotic tissues we can consider. Necrosis is nothing but premature cell death which is due to the autolysis. So if we can see in the injured tissues also, mainly this dystrophic calcification, it is the extracellular deposition of calcium from the circulation or the interstitial fluid. Mainly this will be extracellular deposition which is due to the circulation or due to the interstitial fluids. So mainly this calcium, the dystrophic calcification will be visible to the naked eyes, which is varies from the size of the calcium salts will be varies from small little grains to the rock hard material. So you can see the dystrophic calcification which is placed over the aortic wall, calcification over the aortic wall. So first to get the dystrophic calcification, it needs to have the necrosis, that is the premature cell death, which is due to the autolysis. So once again, two types of this one, it might be dystrophic calcification, whether it needs for the deposition of calcium in the dead tissues or in the degenerated tissues. So which and all conditions we can see the dystrophic calcification, especially in the dead tissues. Mainly we can see in the caseous necrosis, liquefaction necrosis, fat necrosis and infarcts. So mainly in these conditions we can see the dystrophic calcification. Also in the cases of thrombosis, formation of thrombi, hematomas, and in the breast cancer, the patient who is suffering from breast cancer, mainly by doing the investigation of mammography, one could be able to detect the calcification of dystrophic calcification. So mainly the degenerated, so we saw in the dead tissues. Second thing is in that under dystrophic calcification, in that we will see regarding the degenerated tissues. So in degenerated tissues, it might be old scars, atheromas in the aorta, and Mongsberg sclerosis. Mongsberg sclerosis is nothing but where the tunica media, in the sense middle layer of the muscles of the arteries will be affected. So in that cases, if the calcium is deposited over there, in the sense if it is get degenerated, that leads to the dystrophic calcification of degenerated tissues, and also as well as in the tumors of uterine tumors, breast cancer, thyroid adenoma, goiter, etc. In all these conditions we can see with the degenerated tissue, degenerated dystrophic calcification. So we are seeing regarding the fibrosis and dystrophic calcification of pancreatic parenchyma. So this is the microscopic view of the dystrophic calcification. So on your right side you can see the degenerated tunica media of muscular artery of uterine myometrium in Mongsberg arteriosclerosis. In the next picture you are seeing regarding the caseous necrosis in the tuberculous lymph node. Okay. So mainly then we will see regarding the pathogenesis of the dystrophic calcification. So what happens is the denatured proteins. So denatured proteins which binds with the phosphate ions, which react with calcium ions to form precipitate of calcium phosphate. So mainly the proteins which binds with the phosphate ions, which will be reacting with the calcium ions to forms the precipitate of calcium phosphate. Mainly it involves two phases, two steps you can say. So first one is initiation and second one will be propagation. In the initiation phase, where the calcium phosphate starts to accumulate intracellularly in the mitochondria, and in the propagation phase, the minerals deposited in the initial phase are propagated from the mineral crystals. So mainly in the breast cancer, we can do the investigation of mammography, which shows the dystrophic calcification. Next we will see regarding the metastatic calcification. So metastatic calcification, where it leads to the metabolic dearrangements, which leads to the deposition of pathological, in the sense excess of calcium in the body. So mainly excessive in the bone. You can see the picture where it has shown the deposition of metastatic calcification. So second thing is excessive mobilization of calcium from the bone, mainly in the hyperparathyroidism, Mainly in primary, in the stage of primary stage, you can consider where parathyroid adenoma. In the secondary stage, parathyroid hyperplasia, chronic renal failure, and mainly in second thing in the metastatic calcification is bony destructive lesions, which will be seen in the conditions of multiple myeloma, metastatic carcinoma and leukemia. Then we will see the sites where the metastatic calcification takes place. Mainly metastatic is the dearrangements in the sense metabolic dearrangements which leads to the calcification. Mainly it takes place in the kidneys, lung, stomach, blood vessels, cornea and synovium. So, here you can see the lung metastatic calcification. So, finally, we will see the difference between the dystrophic and metastatic calcification. So, dystrophic calcification is the deposition of calcium salts in the dead and degenerated tissues, whereas in the metastatic calcification, deposition of salts in the sense calcium salts in the normal tissues. Second differentiation is calcium metabolism, whereas the calcium metabolism will be normal in the dystrophic calcification, whereas in the metastatic calcification the calcium metabolism will be dearranged. Third one will be serum calcium level. In dystrophic calcification, the serum calcium level will be normal, whereas in the metastatic calcification it will be hypercalcemia. And coming to be reversibility of the condition, in the sense pathological calcification, whether it is reversible or not. Generally in dystrophic calcification, it is irreversible because it starts depositing in the dead and degenerated tissues, whereas in the metastatic calcification it is reversible because if we keep on correcting the metabolic disorders, you can get back the metastatic calcification into a normal level. And causes of dystrophic calcification, as I have said before, necrosis, that is caseous necrosis, liquefatic necrosis and fat necrosis, infarcts, thrombi, hematomas and so on, whereas the causes for metastatic calcification is hyperparathyroidism, bony destructive lesions, prolonged immobilization and so on. Thank you.